Primary care plays a critical role in healthcare delivery as they are a person's first point of contact with the healthcare system. Primary care plays a key role to advise individuals for the prevention of injuries and illnesses. Nonetheless, not everyone can access primary care, as more than 6 million Canadians do not have access to family doctors. Reforms that ameliorate the impacts of administrative overload and burnout risks are necessary to ensure that Canadians have access to primary care options. Currently, there lacks interoperability, the ability to exchange and make use of information within the Canadian healthcare system. Given that individuals may seek services from multiple providers or receive testing from multiple facilities, it makes accessing this data difficult for primary care physicians. Instead of caring for patients, they are spending time trying to find the right information in the right place to coordinate the best care. They spend 10 hours a week on administrative matters, which is valuable time away from patients. 60% of physicians say administrative burden is a direct contributor to deteriorating mental health. This makes it difficult to attract and retain primary care physicians. Therefore, all levels of government must work in conjunction to improve interoperability as a means to reduce administrative burden. This can be done by creating a national framework that promotes effective data sharing practices between different institutions so that physicians can access the patient information they need. This framework should identify strategies in data standardization and propose how AI can be implemented to reduce physician workload. Solving this administrative burden will enable physicians to spend more time with patients and improve their mental health. Shifting to a team-based care model is another reform to ensure that more Canadians have access to the care they need. This is where healthcare professionals work interdependently to provide care to their community. They include doctors, nurses, psychologists, physician assistants, social workers, pharmacists, and community health workers. Adopting team-based care allows healthcare professionals to focus on their area of expertise. For example, social workers can help individuals with their collective well-being, and pharmacists can prescribe medication to individuals. As well, the creation of these teams can greatly reduce administrative burden on employees because team-based care include administrative personnel to handle patient navigation, writing prescriptions, and writing referrals. This healthcare delivery benefits patients because they will be able to access a team that houses a diverse range of healthcare professionals while interacting with a team that is less susceptible to burnout. A barrier to creating primary care teams are the financial costs of adding healthcare professionals as well as creating the needed IT infrastructure. Therefore, more funding is needed from federal and provincial governments to create healthcare teams. These reforms can reduce the burden of primary care physicians while reimagining how care is provided to ensure that individuals have better access to care.